Hi, I'm Kim Shadowan from Lipscomb University's Office of Public Relations and Communications, and today I'm here with Dr. Kevin Eidson from the Lipscomb University Health Clinic, and he is our Director of Health and Wellness, and we want to talk a little bit about health and wellness at Lipscomb University and things that have been happening this summer and things that we need to know for the fall. Kevin, thanks for joining me today. So you've been here for a little while now, not just in this capacity, but tell us a little bit about just yourself, and you're with College of Pharmacy for about a decade and stepped into this role in the spring. So give us a little bit about your background.
Well, thank you, Kim, and it's great to be here with you, and great to discuss what the fall is going to look like. So I have been here for 10 years at Lipscomb. During my time here, I've also been a board member of the Tennessee Board of Pharmacy. Governor Haslam appointed me to the Board of Pharmacy, but I think my career in pharmacy is a little different than the average pharmacist. So let me tell you a little bit about that. So I spent several years in Atlanta going to pharmacy school at Mercer University, and then owning an independent pharmacy in Atlanta, and then moving to Florida, and then back to Tennessee after 9/11. And when our country was at another crossroad of very interesting events occurring. And then after 9/11, I was in bioterrorism with the state of Tennessee Department of Health, and wrote plans to respond to disasters and pandemics and things like that. So this is taking me back to my roots of public health, but I spent a number of years there, and then Director of Pharmacy for Public Health, and then the Executive Director of the Tennessee Board of Pharmacy.
So you really, your whole career has been leading almost to this point. You've had other experience, but
I don't know that this pandemic was written for me specifically, but
we'll go with that.
It is something that I have spent a lot of time thinking about in the past, and then certainly over the last 4 months, 5 months, just spending a great deal of time thinking about where we need to be as a community for the fall.
And so this new role that you've stepped into, Director of Health and Wellness, tell me a little bit about just the scope of that and what all you have been doing and kind of what your role will be in the fall.
So I have transitioned. I have teaching from the College of Pharmacy. I taught pharmacy law and ethics to the pharmacy students, and taught many other courses over there. But moving in since March over into this role, helping out in the health center over health and wellness, not only for the university but also for the academy, and making sure that we've got plans in place to respond to this pandemic this fall. So looking at our capacity in the clinic, building up staffing, building up techniques of how we could do testing and mass testing, and we've actually done mass testing on campus this summer, and so we feel very good that we can do that very well. We've also had contact tracing training. Every one of our employees have been through the Johns Hopkins certificate program and contact tracing, so we're really getting ready for what we may see as a community in the fall, how we mitigate the virus and how it affects our community.
Right. So before we talk about Lipscomb specific details, tell us a little bit about just in the Nashville and Tennessee area, sort of a snapshot of where we are with COVID at the moment.
Right. So our response in Tennessee in general is that we're not in a great position as a state, but Tennessee is a unique state in many ways. We have 8 bordering states, and we have states that, and my public health hat would be mutual aid. They would be sending patients into Tennessee. So what we have going on, like at Vanderbilt, they have increased their capacity in hospital beds and ICU units, is my understanding, and they've done that through various resources, and so they're building up. But we have patients coming in from, say, Alabama and Georgia into Tennessee, where there are absolutely no hospital beds and no ICU units for those patients. So we're getting ready, Tennessee being that unique healthcare hub that we are, we're building up a response that's more robust, because we're having to do it because Nashville, for instance, is a referral hospital for southern Kentucky, even parts of Missouri and other areas referring patients into Nashville as well. So the numbers in Nashville and Tennessee are large. The numbers in Davidson County are over 20,000 cases currently, and probably over 16,000, 17,000 people that have recovered from the virus. So those numbers do look good, and we have a lot of death rate in Nashville, but a lot of that may be due to just the acuity of the patients coming into Nashville and being referred into our level 1 trauma hospital, Vanderbilt. Those numbers would count as deaths as well in Nashville.
Well, this summer, I know you've spent a large amount of time, developing protocols and talking about the testing and all of that. But who has been helping you? I know that you have had kind of a board or a group of folks who have been helping us with that.
Right. We've had actually an advisory committee that we put together, and we've spoken to folks like Lisa Piercy, who is our Commissioner of Health in Tennessee.
Lipscomb alum.
Dr. Piercy is a Lipscomb alum, so we've talked with her team, and they've been with us the whole step of the way. We've spoken to Mark Eidson, and he's the Commissioner of Tourist and Development in Tennessee, and they've been responsive. The Eidson Foundation has been very generous to us in providing resources as well. We've talked to Vanderbilt physician that we have, Dr. Candace McNaughton. She is an emergency room doctor. She is has a PhD in epidemiology, a master's in public health, and she's just a wealth of information for us, and we communicate almost every day.
Yeah.
And then we've got like Paul Peterson, who is the Director of Emergency Preparedness for the state of Tennessee Department of Health. And so he has been a huge advisor to us as well. And then I have to say that our team here in the health center has done just monumental work in getting plans in place as well. So we've got nurse practitioners and physicians that are here working tirelessly,
around the clock almost,
and getting things done.
Well, talk about the protocols a little bit. We see so much, or we've seen so much with what CDC recommends, and sometimes it's a little overwhelming to know exactly what to do. What can each one of us do, or what do we each need to be doing to try to take care not only of ourselves, but everybody on campus?
Yes, the real key to this virus is prevention. Mm-hmm. What can we do to prevent the virus? And so what that means is that we all have to take some ownership in that. We all have to change our hand washing principles that we do. Every time, I tell people, every time you pass by a hand sanitizing station, and they're all over campus, I'm always the one that's over there washing my hands, it seems like, and doing that for at least 20 seconds. I'm going to the sink and washing routinely. That is just really key. And then other things that you can do is wear a mask. That mask that you wear are going to be so important for us mitigating this virus. And I would encourage you to wear it as much as possible. I mean, I realize that if you're in your dorm room or you're at home, that's not going to be necessary. But as much as, if I'm walking across campus outside, I have my mask on. I just think that's being a good citizen and being good and responsible for what we're doing. So that's really important for us. And then I think the other things that I think we need to be doing is just paying attention to what the environment is. We've included our housekeeping folks, and so they know to do deep cleaning. We've bought some really sophisticated and equipment to go in and clean classrooms and common areas really, really well. We've looked at ways to clean those high-touch and coat those high-touch areas with antimicrobial sprays to kill the virus and other things more clearly and rapidly. So that is the number one thing, is preventing the virus.
And I know one thing we've worked hard on this summer is the All Licensed Care Plan, and kind of planting the seed, and getting us all committed that if each one of us does our part, then it helps to protect the entire bison herd. So
absolutely, that plan, if you've not read it, it's very detailed. It's very well put together,
and it's on our website, the COVID site.
and it's easily accessible. Please be familiar with that. And don't just read it once. Read it multiple times so that you understand it. I guarantee you, if you read it 100 times, you've probably not read it as much as we have in putting that together.
Yeah.
We've spent so much time in that plan, and I really feel like that is a really good tool for us to use.
So you mentioned the classroom a minute ago, so let's talk a little bit about maybe some of the measures that you know of that are being taken in the classroom, but more importantly, what can students do, what can faculty do to be a little safer in the classroom setting this semester?
Absolutely. Every classroom has been evaluated to make sure what the COVID capacity is of that classroom. So we're looking at the classrooms to see how many individuals can be in there safely and be physically distanced appropriately. And so we've had our events folks going through every area on campus and evaluating that and giving us data. So first of all, that's the most important thing. If that capacity is there on the door, it's published or whatever, you need to make sure that we honor that. That's there for a reason. And then I think everyone has some ownership in cleaning their area in the classroom. Every classroom's going to have hand sanitizing supplies there for you, and so you'll be able to, or excuse me, sanitizing supplies there for you to use to clean your area, and take that seriously. While our folks in facilities have done a great job, we also feel like that extra cleaning is so important as well to make you feel very secure that your area is clean.
And then in our offices, I mean, you know, before this, we never thought twice about just a shared coffee pot and all of that. You know, what are some things we can do in our offices to be a little safer?
You know, look at your offices as just your own little personal environment. Keep that to your personal environment. I would also encourage you, where you can, is to have meetings with your students, meetings with individuals that you need to have. Do as many of those either in open air areas or out in by Zoom, virtual meetings. I think those are still going to be very important in protecting our faculty and staff and students from this virus.
Maybe even wiping down some common areas and
wiping and cleaning and having a rotation of who's doing that's going to be very important.
Yeah.
We all need to do our part in keeping this community clean.
Yeah. So what about students? You know, so many of them work and they have internships and they're going to be getting out in the Nashville community. What are some things that they need to be aware of as they're going about, you know, some of the activities that they need to do for the classes, you know, and maybe going out to eat every once in a while, but what advice would you have?
Absolutely. And I mean, we all have to go and about our days and doing our work and taking care of our obligations for work and our education. And so be just very alert and aware of what's going on. Do your part, wear your mask if you're out, clean, as I've said before, do all of those things that prevent the virus. And then if you're going out just to eat, you know, I would limit to where I'm going. I would know where I'm going. I would know where the health officials have said these are higher risk areas, and be aware of those before you go out.
So there's also been a lot of about the symptoms that we need to be alert to, and I know sometimes, you know, more symptoms have been added to the list, and maybe others are emerging as being more, you know, more of a red flag than others. So talk to us a little bit about what we really need to be paying attention to. Loss of smell and taste, I know.
Sure. We actually have this Lipscomb Ready out, and it is just has a wealth of information. It has all of our plans on it for you to look at, but it also has a section in there for a self-assessment for the virus. And so it'll ask you questions like, do you have a fever over 100 degrees? And the answer to that is yes or no. So no, it allows you to go to the next question, and it'll ask you for some symptoms. Have you had a cough that's worsened over time? Have you had shortness of breath? Have you had just general fatigue, muscle aches, headache, new loss of taste or smell, and that's probably the number one thing that we're seeing in our age population that we have on campus. Is just a loss of taste or smell.
Right.
You wake up one morning and you don't have that occurring. Sore throat, congestion, and then the GI symptoms, nausea, vomiting, diarrhea, are very common with this virus. I have to tell you that a lot of people are asymptomatic, but yet they're still carriers of the virus and are infectious to others. And so, that's a large number, that people just do not have a symptom at all. So it's very important for you to know your body and know when you're not feeling good and when something is just a little abnormal. You have to be more sensitive today to those things than ever before. And then on this app, it'll also ask you to confirm that you were not around anyone that has been exposed or tested positive to the virus within the last 14 days. So I think those are really important things for you to keep in mind.
And you can get the Lipscomb app on just, you can go to the Apple Store or something like that and download it for free, correct?
Just go to your app store and you can download this app, and it will. It's just a great tool for you to have, and it gives you all kinds of alerts, whether it be weather or any other event.
Any kind of active situation on
It's just a great resource for you.
Yeah, that's great. So maybe I have some of these symptoms, and I think I'm getting sick. So let's first talk about. I've been exposed to somebody who's tested positive. What do I need to do? I think students and employees have similar paths to follow that all lead probably to you.
Yeah. Yeah, that's a great question. So we look at those direct exposures, and a direct exposure is someone that's been in close proximity.
Okay.
And we kind of define that as within 6 feet for 10 or 15 minutes or greater. And so that's what we would look at as a direct exposure to someone that's positive. You know that person's positive. And so that would mean that we would ask you to probably go into quarantine based on those the situation and whether or not you were wearing masks and how long you were there. All of those would play into our decision. But we might ask you to go into quarantine if it's a direct exposure for 14 days.
Okay.
And if you're asymptomatic in that 14 days, then after that 14 days, we'll allow you to return back to our community and your normal daily activities. If you are a positive individual, we're going to ask that from the day that you started showing symptoms, you'll be in quarantine or self-isolation for 10 days, and you can get out after 10 days of that self-isolation, provided that you are afebrile, in other words, no fever, that lasts 24 hours, and minimal symptoms.
That seems to be a fairly common standard for any illness that you have. If you're, you've got to be fever-free and.
That is very similar. Most things we say, 48 to 72 hours. This virus is a little different. We won't require you to have a negative test to come back on campus once you're positive. That's really against what CDC and the state of Tennessee Department of Health guidelines say for us, but we do want you to maintain those timelines.
Sure. And you do the testing here, or you can do testing. What services do you provide here? And
we can do pretty much anything primary care for our community or our students, and so that includes we can do strep testing, we can do flu testing, we can do immunizations. And then we can also do the COVID testing. We can do one of two ways. We could do a PCR test where we would send that to our lab and have that evaluated, or we would do a rapid test, which is an antigen test. And we can get those results in about 15 minutes, maybe an hour after we administer that test. And so they're very sensitive, very specific tests, and give us a good idea of where you're at.
And then you go into the contact tracing mode.
Yeah, and that's actually probably
Yeah.
one of my most favorite pieces of this
Yeah.
because it's like putting together a huge puzzle.
Mhm.
So we're going to ask you for the 48 hours prior to the time you started showing symptoms or when you got a positive test result, we're going to ask you a lot of questions.
Mhm.
Where have you been on campus? Who have you been with?
Right.
And we ask those questions for a lot of reasons because they could be a direct contact at that point and may need to go into quarantine. But we also ask those questions because those may be areas that we need to address with our facilities folks for
Sure.
more intensive cleaning.
Mhm. Yeah, that's a good point. But people don't need to just come in. Like I know that you're located, on the north side of campus and have this great facility, but they need to make an appointment, right?
Right. We want to make sure that we can protect everyone. We want you to have an appointment. We're going to do well visits in the morning and sick visits late morning and afternoon. And so we really want to make sure that we can keep everyone protected as well.
Tell me about your team. You mentioned them just a minute ago, but they've been working really hard, and just tell us about them.
We've had a team. We had a core team that have been here for years, and then so we've added some additional nurse practitioners and RNs as well. And so they're going to be providers here. They're going to be seeing patients. They're going to be working in contact tracing. They are going to be working on just daily activities that we do all day.
Pretty hard-working team, I'd say.
It is. We are here for you. If there is a community member that needs us, feel free to reach out to the health services email address or as well as calling us. Our phone number is 615-966-6304. We'll be glad to address any questions that you have, and we're here for you.
Well, thank you so much for taking a few minutes just to tell us a few things we need to know for the fall.
All right, thanks, Kim.
Thanks.